often ask me why I wrote this book. And the honest answer is out of frustration. Because I'm going to just be honest, I got tired of people coming to their visits and they don't know the things they're supposed to know. Like, bring your medicine bottles with you. What? And so I was telling a patient about this, and she said, why has nobody told me all of this? It was more than just that I was telling her about. And then I thought about it later, and I said, yeah, nobody really tells people this. And as doctors, we assume that you know, but it dawned on me that people don't know. Big one, know your family history. People don't know why that's important. Know your own history. I've had people don't know which ovary was removed. I've had, you don't know if your cervix is still there when you had a hysterectomy. Don't know which body parts were removed with your surgery. You're supposed to know this. And people don't think it matters. And this book is saying it matters to know what's going on with you. And what I tell people say, well, I ain't no doctor. I'm not asking you to be a doctor. But you should know what's going on with you as an individual. And so my big thrust in this book is about making life choices and how choices that you make in your life matter, and choices that people make in their life leads into the doctor's visit. Things that you wouldn't even think about, like what job you took, how stressful it is, if you're sitting down at a desk all the time, who you chose to marry, who you didn't marry, if you chose to have kids or not. A lot of people, more than not, when people talk to me about kids, they say they wish they hadn't had them. That's a real thing. Now, people will tell me that, they won't tell other people that, but that's how people really feel, because they make choices. How you treat people, that's a big one, because when you take care of patients, and they don't even have to be older, they can be 40s, 50s, 60s, and beyond. And I say, who's making sure you take your medicine because they're having an issue? Who's making sure you eat? But if you pissed off everybody in your life and treated everybody bad, even your kids, when it's time for you to need them, they ain't gonna be nowhere to be found. You may think your child is different, but they ain't. I had a patient, I was in the room with the patient, calling his son, pleading with him to supervise what's happening with his father. He's like, I can't do that, and hung up the phone.
Wow, I believe it.
So it's not, some things that happen with your kids, it's just their personality. A lot of it's how you treated them. Yeah. And it's their perception of how you treated them.
Their perception. That's a
which is what matters. So you got to communicate with your children, and choice about how you pick your friends. And now social media leads into doctor's visits. So that's also choices about what you post in, all of that. And so I coined a term called regretitis. Somebody tell me what they think regretitis is before I tell you. What is regretitis? After I said all of that. There you go. You regret what you didn't do to make it better. And one day I was talking to a patient, and I was telling her about her medical issues and, keeping up with PAP and mammograms and explaining all this. And she said, I should have kept up with this, but I didn't. And And the word just popped in my head as I was talking to her. And that's where shoulda, woulda, coulda came from. That's the name. Chapter 30. That's the first line in that chapter. Shoulda, woulda, coulda. And if I had $1 for every time I've heard people regretting choices that they made or didn't make. A big one is not keeping up with your screening. Pap test, mammogram, prostate cancer screening. A lot of people, I don't want to do that.
Cancer,
colonoscopies. I don't want to do that. Well, you're going to have your lips poked out, and then you're going to be coming talking to me. But you're not going to like what I got to tell you at that point. And so that is what regretitis is. Not going down your life journey and not limiting your choices. So once you make a decision or don't make a decision, you're on this path. Not on this path. And once you're down this path, you can't go back. You can't jump over here no more. So as you keep going, if you keep making bad choices, you're going on a road that you can't get off of. And so that's what regretitis is. And the other component of it is people get to the point where they made these choices and they get paralyzed and they get stuck. So that's the good part of this. If you're on that path, you can't get stuck on the choices you made in the past. You can't change them, so you gotta go forward. And some people get stuck, and with all of this I hear about in the doctor's office, because it's also affecting their life choices. And I must say, included in that is the food you choose to eat. Now, if you want to eat crap for 20, 30, 40 years, and then stuff starts happening, some of that I can't fix. Some of it you can, a lot of it you can fix, or at least make it not worse by changing eating habits. And so that's a lot of what I do, helping people change their lifestyle, change their eating habits, lose weight, and it's changing your mindset about what you think about food. You got to change your whole relationship with food. And so I'm actually doing a lecture series. I've already recorded one. I have a 6-session weight management lecture series. It's called Weight Management for Sustainable Weight Wellness. But a lot of it is about choices. And a lot of times people don't know what to eat because they weren't taught. And so we have, as doctors, we have to have you unlearn things and relearn things. And so, lastly, so all of this is about choices. So you don't regret the choices you made and have to deal with regretitis.